Our brains are made mostly of fat, so why not nourish them with the highest quality omega-3s available? Omega-3 Rejuvenate from Big Bold Health. Omega-3 Rejuvenate is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. This is not the story of other brands. The fact is, most of the world's fish oil products are produced from several types of species packed into nets in commercial fishing zones, loaded into the holds of vessels that stay out for days or even weeks, and put in processing plants that treat them with high heat, chemicals, and synthetic nutrients. Big Bold Health does it differently, all of it straight from the sea into the hands of skilled fishermen, instantly flash frozen and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique low-temperature extraction preserves the natural goodness of the fish so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman for 20% off site-wide. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today we're hosting Dr. William Levine, who is a board-certified periodontist with 35 years of experience. He's an expert in oral inflammation, and we're focusing on periodontal disease, and not just as a cosmetic problem because it can make you lose your teeth, but as a problem that has systemic ramifications because it is associated with cardiovascular disease, stroke. It's associated even with dementia in some studies, and overall has a deleterious impact on health. So, Dr. Levine, just before we get back into our discussion about oral health, we're speaking to you directly from your practice in Jerusalem. And so Jerusalem is in the news these days. Tell us a little bit about what's happening from your perspective, because you're a dentist. You have a busy practice there. Does life proceed normally for you, or are there some dramatic changes?
So first of all, thank you for your concern, and thank you for asking the question. Life here has really not been normal, although there is an attempt to maintain a facade of normalcy. On October 7th, we suffered a terrible invasion and massacre of quite a number of people. It was 1,400 people to be exact. And we're a relatively small country, so that would be the equivalent of about 30,000 people in the United States, and all in one day. So it was a terrible blow. And there was a call-up of the reserves all over the country, and it's had a major impact. There's not a family that doesn't have friend or children who have been called up to the army to defend the country. And I had two sons in the army, and quite a number of nieces and nephews who were there. Unfortunately, I lost two nephews in this war.
Goodness.
Which was quite a terrible event. Young boys at the age of 21 and 22. And so it's been a very rough period for myself and my family. That said, despite that, people still need dental treatment. People still need care. The homestead is still functioning. The economy took a very large hit because people were just in no mood to shop or do anything like that. But we're resilient people, and we're just trying to go back to maintaining our normalcy while at the same time not losing our sense of concern and struggle with the events that are developing. So, thank you for your concern on a personal level. Yes, it's been very rough. On a national level, it's been very rough, but people need to live, and so people find a way.
As a periodontist with 35 years of experience, presumably you're a little bit too senior to be called up for a frontline combat
Yeah, I
role.
did my time.
But
That is
but
true.
have you been called upon to do some special support for the military in a dental capacity, or just are you working with only civilians at this point?
My personally, I have not this time, but this very interesting phenomenon. Most identification of, unfortunately, some people were massacred and burned very terribly, so there was no DNA residue to those people, and they needed to report back to the family as to, was their loved one alive or not alive, and so they called in forensic dental teams in order to help identify. And they did that by looking at old x-rays and teeth, because as you know, teeth are not affected by fire in terms of
Hmm.
destruction.
Yeah.
So they were able to use the old x-rays to identify the bodies. And it was quite a puzzle putting some of these pieces together. But the dental team was working nonstop for about 2.5 months, 3 months. And these were my colleagues and my friends. I have done that in the past, but I was not called upon this time.
Okay. And is there a feeling of insecurity as you walk around in Jerusalem, or are things is the war
Absolutely.
putting a damper on
Absolutely.
the normal festive atmosphere in that beautiful city?
Yeah, thank you. Yes, absolutely. Yeah, absolutely. Restaurants have reopened, some have closed. People are pretending to be normal, but there's a definite level of stress and tension that's pervasive.
Okay. Well, thanks for sharing that information, and we wish you and your family safety and a speedy resolution of this crisis. And now back to our subject, which is periodontal disease. Okay, so for people who have periodontal disease, let's talk first about what some of the standard treatments are. My understanding is that there's various types of surgery that are available. Often people are given uh, antimicrobial rinses like chlorhexidine. I think even tetracycline has been used as an antibiotic. I think it's sometimes used topically. So, can you run through some of those conventional options, and then tell us a little bit about your research uh, looking at plant bioactives as potentially an alternative to some of the harsher interventions?
So I'm going to just sort of recap a little bit.
Yep.
Basically, periodontal disease is a infectious inflammatory disease. It starts off with a microinfection which stimulates the immune defense system of the gums, and then that immune system or defense of the gums becomes actually a causative part of the problem and causes destruction to the bone holding the teeth in place. So when we see a patient that has active periodontal disease, the first thing we want to do is try to reestablish that normal defense mechanism. So we need to clean out all the bacteria. We need to clean out all the bacteria that's hardened into calcium deposits, what we call calculus, which are hardened bacterial deposits that look microscopically like coral in the ocean, and also can house active live bacteria. So we clean all that out and we take off the toxins that have embedded
So,
themselves
so
in the
this is, by the way,
bacteria
this is
in
the
the root
so-called
surface.
scaling, sometimes referred to as scaling.
Absolutely, that's it.
Okay.
Right. It's called
Okay.
scaling and root planing. And
Okay.
the idea is to remove all the toxic elements to allow the body to reset and find its own place and even begin to have a reattachment or reconnection, is more precise, of the gums to the tooth. Once we've established the level of health we can get through non-invasive techniques, we have to evaluate, well, what are we going to do at stage two? If there's a need for stage two, if we stabilize the disease, we can maintain it the way it is with just the initial treatment. But if we haven't, we have to consider surgical techniques to either access infection or to rebuild bone. We have to consider laser techniques, which are becoming more and more popular in dentistry and a field in and of itself where we can use the laser energy in the very deep pockets or spaces where the bacteria has caused damage, and to restabilize those areas and even to regenerate some new bone growth. So we have a lot of new techniques that are available over the last decade to help improve stabilize, and then even reverse part of the periodontal disease. But one of the critical, and I think most critical aspects of this is, like we said earlier, it's an autoimmune disease, it's an infectious inflammatory disease. We need to find a way to maintain the health after you've had the treatment or even during the treatment, because otherwise it's just going to recur again. And that's when I had my aha moment as a dentist, when I kept saying, okay, I'm great at what I do, and I am. And I'm great, and I take good care of my patients, and I stabilize their disease, and they're doing well. Now, how do I make sure that that disease doesn't recur? Because in the past, we've had recurrence rates of between 17 to 25% of well-treated cases had recurrent disease. That's an enormous level of failure for a clinician. That means 1 out of every 4 to 5 patients are, even under your active, thorough care, are having recurrent disease. That's not good. So how do we improve the protection of the gums and prevent that recurrent disease after the good work that we've done and after the work that the patient is doing to maintain it? So we began to look around saying, well, killing the bacteria by itself is not sufficient. And the reason for that is
Excuse me, and that
twofold.
would be
Number one,
with things, treatments like chlorhexidine, which is a chemical disinfectant,
correct.
and or things like Listerine, which is over the counter, but chlorhexidine I think is only
So all
administered.
the rinses that are out there can be divided into 2 groups.
Yeah.
One that have fluoride to protect against cavities,
Mhm.
and the others that have antiseptics, whether it's a CPC, whether it's Listerine, which has alcohol and essential oils, whether it's chlorhexidine. There are many different types of antiseptics. They're relatively harsh. They swoosh around your mouth and they kill off all the bacteria, the good ones and the bad ones. And the problem with the antiseptics is that they can't penetrate through a biofilm, and they can't penetrate under the gums where the tissue, where the worst bacteria are residing. So you're really not getting an effective treatment from the antiseptics. And when I looked at this and I said to myself, well, how am I going to help my patients help themselves? Because I don't want them to be in my office daily. I want them to come in periodically, whether it's once every 3 or 4 months, and be tweaked and torqued up so that they're healthy. But I want them to come back to see me healthy. I want it to be a maintenance visit, not a treatment visit. So what we did was we sort of stepped out of the field of standard medicine, which tends to use single chemicals to accomplish a specific goal. So, for example, an antiseptic is a single chemical entity which will kill bacteria. We wanted to approach this slightly differently. We wanted to look at a way to both reduce the bacteria, but also strengthen the gums to prevent more disease. So what we did was we looked into the world of plant bioactives, because plants contain an enormous amount of pharmacologically active compounds which can work just like drugs, but not without necessarily some of the harsh effects. There's another advantage to plants in that most plants have hundreds, if not thousands, of active pharmacological ingredients or compounds, so that if you can design that plant properly, whether by altering harvest, altering growth patterns, and altering extraction technology, knows how you pull those bioactives out of the plant, then you can actually target many things in the disease. So you can reduce bacteria, you can strengthen the gums, and you can reduce the inflammation, which is the causative agent. So what we did was we spent, more than 10 years of research analyzing different plants, finding out which parts are active, which parts will work synergistically together. And we've put together a mouth rinse that's called Periactive. And Periactive works like no other mouth rinse does. What it does is it reduces the bacterial level, and it does so by 2 factors. Number one, it reduces the nutritional support for the bad bacteria, so it selects out the good bacteria. And number two, it actually kills all the bacteria slightly. So it reduces bacteria overall.
So it's
most importantly,
suppressive. It's not, it
selects out
doesn't
the healthy
eradicate
bacteria.
all the bacteria, like
Absolutely
like an
not. Correct. Because
antiseptic.
that would be negative. Correct.
So okay. So
Absolutely. The second thing it does is actually penetrates into the gums. It doesn't sit on the surface and wash the surface away. It actually goes into the gums like a normal medication would, and actually activates two processes. It reduces the inflammation by turning off some of the pro-inflammatory mediators or things that are causing the inflammation. And number two, it actually stimulates the body to repair itself. So we'll see less swelling, less redness, less irritation, and thicker, more healthy, more robust, and vital gums with a thicker collagen level and a thicker protective, what we would call epithelial layer, which is like the outer layer of the skin of the mouth. So those two factors, reduction of inflammation and promotion of repair, will actually help prevent future disease. So we see our patients coming back much healthier than we ever did before. We launched this product in Israel about 6-7 years ago, and we've been tracking it since. And now we're having a big launch in the United States. Beforehand, it was available only through dentists, and now it's going to be available directly to the consumer because the results have been so wonderful that we actually patients are really clamoring for it. And once you start using this, you'll feel the difference. Your gums will hurt less. They'll be less irritated. The bleeding will be reduced significantly, and you won't get that with any other mouth rinse.
Is this available in retail stores or only online at this point?
No, not yet. We're only selling direct to consumer online. And you can actually, it's available. The mouth rinse is called Periactive, and it's available on the site called getperiactive.com.
Okay, and what are some of the constituents of that? I know it's a proprietary blend, and we don't want to give away the secret the secret
I'm happy
sauce.
to share because
Okay,
the way the secrecy is not in the ingredients. The secrecy is how we have analyzed how to maximize these bioactives in the plant and select out the specific ones which are active. That's more the secret sauce. But there are three well-known bacteria. Sorry about that. Three well-known botanical plants. One is called Centella asiatica, which is a plant grown down in the African peninsula in Madagascar, actually, and other places as well. But it's well known for its healing qualities. We look at Echinacea purpurea, which is well known for its anti-inflammatory properties, as well as Sambucus nigra, which you're familiar with the Echinacea probably. You're familiar with Centella, and
Centella is gotu-kola.
Actually,
It's the herb. It's commonly referred to as gotu-kola,
yes.
right?
Well, good. Yeah, absolutely. Yeah. And then the other one is Sambucus nigra, which is elderberry.
Right. Which is, by the way, a lot of research comes out of Israel looking at the benefits of elderberry as an antiviral for the flu.
Absolutely.
Right?
Yeah. I'm very familiar with the people who developed it. They're very. It's a lovely product. Yeah.
Okay. So that combination of ingredients, has multiple effects. I was also wanted to ask you about another potential treatment for mouth bacteria and biofilms, which is xylitol. Xylitol is in the literature, and actually one of our sponsors makes a series of dental products, spry dental defense products, which could be used synergistically with yours. I'm pretty sure they don't incorporate some of your the innovations that you have in Periactive, but is xylitol a plausible treatment to suppress mouth bacteria and attack biofilms from your research?
To a certain extent, yes. The way xylitol works is xylitol is a stimulant for our saliva. So the xylitol itself is not an active component, but it's by stimulating an increase in saliva, it helps lubricate the teeth. It helps inside the saliva. There are a lot of antibacterial and natural meaning part of your human natural normal body, a lot of antibacterial components. So by taking xylitol and leaving it in your mouth for a period of time, because it has to stay there a little bit. You can't just eat xylitol and expect it to have an effect. It has to be in your mouth. And so it's good to put into sucking candies or
and in gums,
or sprays,
or mouthwashes,
gums, exactly.
Yeah,
and it will reduce the bacterial population. It's not quite as strong as the rinses, but it definitely has an effect. And although we've never tested it, based on the mechanism of action, it would have a positive and synergistic effect with Periactive.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. Here goes. Listen up.
Are you concerned about your blood pressure? Join the millions worldwide who have chosen Kyolic as a natural alternative to support their heart health. Why Kyolic? It works. Over 900 published scientific articles and research studies have shown that Kyolic aged garlic extract has a positive effect on cardiovascular risk factors such as high blood pressure, cholesterol, circulation, blood sugar balance, and more. Kyolic aged garlic extract, organically grown garlic aged for up to 20 months for maximum purity and potency. Gentle on the stomach, easy to swallow capsules with no offensive garlic odor or taste. Visit Kyolic.com. That's KYOLIC.com. Learn about Kyolic Formula 109 for blood pressure, as well as Kyolic's other cardiovascular formulas. Kyolic is sold at Sprouts, Natural Grocers, Whole Foods, and natural health stores everywhere. Also online. Get Kyolic Blood Pressure Health Formula 109. It works.
Thanks for listening. Thanks for supporting our sponsors. They, of course, are what make intelligent medicine a continuing free resource to you. And now back to today's guest, Dr. William Levine. I just want to say parenthetically, when we went over, risk factors for periodontal disease, we forgot to include the elephants in the room, smoking and alcohol. They certainly do contribute to the incidence of, right? So really, when you
Terrible.
see patients...
Yes.
And unfortunately, from what I recall from my experience in Israel when I was a teenager, that's actually where I took up smoking because smoking is pretty pervasive in that country. So, yes.
It is.
So you urge, and it took me a couple of years to overcome that addiction. Alcohol too has an adverse effect on the mouth. And there are many people with dry mouth conditions, people with autoimmune diseases like, Sjogren's syndrome, and people who've had various types of cancer treatment that have affected their salivary glands. Older people in general, they just may not make enough saliva.
And a lot of drugs, particularly some of the psychoactive drugs, have
cause
a
dry
tremendous
mouth.
decrease in saliva production. Right.
Exactly. Yes.
And some of the cardiac drugs also.
Yes.
Yeah.
I wanted to ask you a question which comes up among many of my patients who have osteopenia or osteoporosis, and they're put on these medications, the bisphosphonate medications, and lately Prolia. And these have been associated with problems when people experience periodontal disease and tooth problems, right?
So it's very interesting. There are actually two major problems associated with the bisphosphonates. One,
and that just to mention, it's Actonel, Boniva, and Fosamax. Those are the chief ones, and then there's the IV one, which is
the Prolia. So actually, I'm a I would call it a relative fan of the Prolia because of the, and I'll explain to you why.
Okay.
The bisphosphonates are a drug that gets into your bone and stops the bone from having what's called resorption, or a reduction of the calcium layers in the bone. So it keeps your bone stiffer and stronger, but also less vital. And what happens is in the mouth, we have a reaction which is counterintuitive in a sense, because in the rest of your body, it's thickening your bones, but in the mouth, it can cause what's called a disease called merange, which is an acronym for medicine-related osteonecrosis of the jaws, which, to translate very simply, it's medications that have caused cysts developing in the jawbone, spontaneous cysts which cause a loss of bone, that's why I say it's counterintuitive, because you're seeing bone destruction as opposed to bone building. So that's one problem that you have. That's about 1 to 4% of the population taking bisphosphonates will develop. So it's relatively rare, but it is present.
But excuse me, is it more common in people who have pre-existing gum disease or have dental implants?
Not merange. Not merange. Merange is not related to periodontal disease, but it is related to to the fact that it also causes a lack of functionality in the bone. As I said earlier, it's less vital. So the bone, in order for it to heal, has to be removed, the dead bone, and replaced with live bone. And the bisphosphonates affect the capacity of the cells that replace the live bone, the osteoblasts, and they also impact the ability of the osteoclasts, which are the bones, the cells that remove the non-functioning or dead bone from, and so that delicate biologic system is
Right.
impacted tremendously.
So
by the
it's called
bisphosphonates.
remodeling. It's the constant buildup and
Yeah,
removal of excess
correct.
bone, which is sort of a yin and yang of bone optimization, right? So the remodeling is impacted, and if the remodeling isn't happening, then problems can occur in other parts of the body.
And so let's say you need to do some treatment on the gums or the bone or even the tooth, let's say an extraction. The healing will be
I see.
very not predictable, and you could cause tremendous amounts of bone destruction because the healing capabilities of that area have been so reduced.
Okay,
So the reason we like
so
in
when
our office and we encourage Prolia,
yeah, I was just going to say, so somebody who is on one of these drugs, and they're just so pervasive, especially in the U.S. and probably also in Israel, because Israel is very is a country where medicines are as popular as they are in the United States, ubiquitous. There's many women on these medications. So let's say they're in line for a dental implant. This is what you specialize in. Do you tell them to go off the drug, or do you tell them that they're not suitable for an implant, or what's the procedure there?
So the protocol for standard bisphosphonates is a 6-month stoppage of the drug.
Okay.
In reality, that doesn't have an impact. In other words, doctors need a solution. But in reality, once you've taken a bisphosphonate, it's in your system and in that area forever.
I see.
It's very hard to get rid of. So drug holidays help very slightly, but it's the best we can do. There are certain drugs which don't stay in the system. That's why I like Prolia. Prolia lasts for 6 months. It doesn't stay.
Okay.
So I get a chance to do necessary work at the 4.5 month date to the 6.5 month date. So it's what we would call a drug holiday, and where they at 4.5 months after their 6 months, every 6 month injection, we will be able to do work on that patient, and then we'll take a break again at the 6.5 months and get back on the Prolia because you can't stay off it for too long.
Okay, well, that's great.
Yeah.
That's a very nuanced discussion of this complicated issue, because it is a concern, and the fact that certain medications make patients less amenable to sometimes necessary dental procedures, I think that's kind of a red flag.
Yeah. And it's not stressed enough. In other words, my patients will come in and say, look, our doctor recommended that I get on osteoporotic medicines. I said, please speak to him, number one, and say, is it absolutely necessary, or are you just a mild case and maybe we can watch and wait and change this with diet? Let's say I do get a positive response from the patients who want to think about it. Doctors are a little less open-minded sometimes, and then the second thing is, I said, and if your doctor is going to use that, let's please look at some of the more up-to-date drugs as opposed to some of the old, early developed bisphosphonates, which can cause long-term problems.
Are you a proponent of flossing? Because
definitely, we didn't touch on that, but brushing is only part of the problem, part of the solution, because you can only brush the teeth that face the cheek and the tongue or the palate. But what about the sides of the teeth? So you need to use some type of interdental or something for the sides of the teeth as well. So we use their special picks that go in between not necessarily toothpicks, soft rubber picks, which can go in between your teeth, and floss, which is really effective. Yeah, it's very. I
actually prefer those soft rubber picks to the flossing. Somehow I never really got into the flossing habit.
It's mechanically hard.
Yeah,
and they're not quite as good, but they're good enough.
But they're acceptable,
and people will use them. Yeah.
Mm-hmm. And when it comes to toothpaste, People have a wide range of choices. Is there a type of toothpaste that's preferable? Some people, suggest that you just brush your teeth with baking soda or something, that's kind of neutral.
So the baking soda is a concept that was very popular about 20 years ago. It's a mild antiseptic. It's slightly abrasive, so I don't really like my patients to use it unless there's a specific reason, because you can wear out the neck of the tooth and cause real damage with a baking soda. But I do recommend fluoride toothpaste because it depends on the case. Some patients have a high caries rate, and if they're not being managed well enough, then they'll develop dental problems with the cavities. So the over fluoridation is not good, but some of it can be very protective. So that's how we manage it. I do recommend, depending on the case, whether it's more of an antiseptic approach or more of a caries protection approach, depending on what the patient would need.
Okay. Well, great stuff. And, we've had a really comprehensive discussion of oral health. And the take home is that for those of you who are in the majority, and even if you want to prevent yourself from becoming one of the majority of people with periodontal disease, there's a great natural solution. It's Periactive. You can find it at the website getperiactive.com. And this is, I think, the product of some really innovative research by today's guest, Dr. William Levine. So thank you very much for joining us today.
Thank you, Dr. Hoffman.
And all the best to you as you continue your practice at the Jerusalem Perio Center. And all the best to you, your family, and your countrymen. Stay safe and hope for a successful outcome of the crisis. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. There were many important reasons why I started my FullScript online supplement dispensary. I wanted to offer you the same curated professional-grade supplement brands that I use, the ones I know and trust. I also wanted to ensure that they weren't counterfeit or expired. Recently, I've been hearing more and more about counterfeit or expired products purchased from online retailers. With FullScript, you can be confident your supplements are genuine and they'll arrive with optimal freshness and potency. Also, buying through FullScript offers fast, free shipping, optional refill reminders, and a highly rated mobile app. It's safe, secure, HIPAA compliant, and offers world-class support. Go to drhoffmanstore.com for more information and to start your free FullScript account. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. To get started, just go to drhoffmanstore.com, drhoffmanstore.com.